Pet therapy, a camp therapy presentation by Daniel Heimberger. Animal-assisted therapy is a broad term that includes animal-assisted therapy and other animal-assisted activities. Animal-assisted therapy is a growing field that uses dogs or other animals to help people recover or better cope with their own health problems. Things such as heart disease, cancer, autism, or mental health. Animal-assisted therapy originated in Belgium sometime in the Middle Ages, and there are references to the fact that the early Greeks used horses to lift severely ill patients' spirits. In the 17th century, physicians reportedly began using horses as treatments to improve both physical and mental health issues in their patients. Then, in 1961, an accidental discovery led to the first formal research of animal-assisted therapy. Basically, Dr. Levinson was working with a withdrawn and mentally impaired patient. He briefly left the patient alone with his dog, and then upon his return, he noted the young patient interacting with the dog, improved mood, and being more outgoing. This led to further research on the impact of pets and the coining of the term pet therapy. Other notable champions for pet therapy, Dr. Sigmund Freud. Dr. Freud utilized his own dog in his clinical practice. He believed that his dog could judge a person's character accurately, and Freud also believed that having his dog present in his therapy sessions had a calming influence upon those patients. Also, Florence Nightingale was once quoted as saying, "A small pet animal is often an excellent companion for the sick." Indications for usage of pet therapy. According to the Mayo Clinic, animal-assisted therapy can reduce pain, anxiety, depression, and fatigue, as well as has a multitude of other benefits. This allows many patient populations to benefit from pet therapy, including children, people receiving cancer treatments, clients in long-term care, PTSD patients, dementia patients, and those with anxiety. Furthermore, pet-assisted therapy can also have a positive impact not only on the patient, but the family members who visit the sick as well. According to the Mayo Clinic, family members and friends who visit or sit in on animal visits say they also feel better after the visit. Indications continued. Further indications include trust building, those who have to hone in fine motor skills, improved independent or assisted movement, help children through dental procedures. Again, children are large beneficiaries to this style of treatment. It can also help children make connections that are free of judgment. It can teach compassion. It can improve organizational skills, increase self-esteem, demonstrate love, build self-confidence, teach compassion, and increase a child's willingness to join in activities. Again, a multitude of benefits from this style of care. Contraindications, there aren't a ton of side effects or adverse reactions as, this is not a non-medical form of care, but the Mayo Clinic does say that the biggest concern, particularly in hospitals, is safety and sanitation. Most hospitals and other facilities that use pet therapy have very stringent rules that ensure that the animals are clean, vaccinated, well-trained, and screened for appropriate behavior. Again, they don't want to be liable, and they want, just to make sure that because they're using animals, that they are clean and safe. Cultures that can benefit from pet therapy. Culturally, there are so many who can benefit from this type of can therapy. It's non-invasive, it's non-medical, and it can be modified to fit the client and their specific needs. Just a little bit of breakdown, I guess, of those who can benefit from it would be, again, sick children, huge beneficiaries, the elderly, cancer patients, military veterans, the mentally ill, and autistic. As far as health teaching, one thing to note is that a dog or animal, or any animal for that matter, that's trained specifically for therapeutic purposes will almost always be a better option than just a random animal picked up off the street. So teaching patients, they should not expect the same positive results with every animal interaction is something that should be done. A recent 2015 study regarding pet therapy was conducted to find quantitative evidence or quantitative data on the effect of patients and pet therapy. The study focused on the implementation of canine therapy in the adult population for a multitude of ailments. Some of the results from the study include that 86% of patients undergoing chemo preferred, when given the option, to be in a room with a therapy dog. So, given the option of being in a room with the dog or not, 86% decided they would rather be in the room with the therapy dog. Also, 33% who suffered from anxiety in regard to MRIs, 33% reduction, I should say, in patients who suffered anxiety. So if you're going in for an MRI, if you spent 15 minutes with a therapy dog, 33% of those patients reported reduction in anxiety. And lastly, when introduced into a chronic pain facility, 23% of patients reported a decrease in the severity of their pain. So, huge numbers for those patients. A couple of references here in regard to all the research. But again, pet therapy, a great tool in helping ailments for a multitude of patients.